The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody, and welcome to the PSR webinar, Advancing Green Justice in Washington State. This is Barbara Gottlieb. I'll be your hostess or whatever today, and we're going to wait just a few minutes to get started to allow a few more people to join the call. Good afternoon. This is Barbara Gottlieb. I'm the Environment and Health Director for Physicians for Social Responsibility. Welcome to today's webinar, Advancing Green Justice in Washington State. This is the second in our three-part series highlighting the work of PSR chapters that make racial and economic justice an integral part of their work to fight climate change and transition our society to clean, safe, healthy, renewable energy and energy efficiency for all people. I probably don't have to tell this audience that climate change is an existential crisis. A recent study that uses NOAA data suggests that most or all of the years between 2019 and 2028 will be among the top 10 warmest years since climate record keeping began. The Arctic permafrost is melting. There are historic wildfires scorching California. The Gulf region is bracing for a fierce hurricane to hit just days after another near hurricane, and we still haven't stopped burning fossil fuels. PSR's Environment and Health program focuses on climate change and fossil fuels, but today's multiple crises demand that we address those issues through a broader lens. The coronavirus pandemic has upended the way we live. It's affected the way we work, whether we work, who lives, and who dies. Here in the United States, the disease has hit people of color, and especially African Americans and Latinx people, in totally disproportionate numbers. And this is not some random phenomenon. It reflects the underlying health inequities in America, which includes societal factors like the types of jobs people of color hold, whether they have access to health care and health insurance, and other factors that affect health, from housing to income inequality to the constant stress and pain from discrimination and racism. Racism itself is another crisis, and that of course includes the continuing police shootings of Black people. In response, there's emerged a powerful protest movement led by people of color, often young people, and joined by people of all races and all ages. This movement is protesting not only police violence, but a whole system of racist practices and policies. For those of us who are white, and many of us in PSR are, we're challenged to look deeply at ourselves, our implicit and explicit biases, our actions, and our inaction, and to change. So it's in the context of these urgent issues that PSR is taking steps to commit ourselves more fully to environmental justice. Some of our chapters have been working for environmental justice for years. As I mentioned, this is the second in our series of 3 webinars highlighting that leadership coming from our chapters. So today we hear from PSR Washington and also from one of their environmental justice partners, Front and Centered. Next slide, please. We'll hear from 3 presenters today. First will be Ken Lanz. Ken is a founding member of Washington PSR and a retired general practice physician. He first became involved with WPSR as one of the founding chapter board members in 1979 upon moving to Washington State after finishing medical school. While his concerns were initially about nuclear issues, Ken has become increasingly concerned about the threat of climate change. He completed public action and speaking training through the Climate Reality Project and regularly puts that training to use as a member of WPSR's Climate Change Task Force. Our second speaker will be Samir Ranad. He's the Civic Engagement and Policy Manager for Front and Centered. Samir is from Kennewick, Washington. He holds a BA in Political Science from Washington State University and a master's degree in public administration from the University of Washington. He boasts extensive work experience in government advocacy and elections. He has been a staffer in the state and federal legislative branches on multiple state and federal candidate campaigns, and interned for several environmental organizations, including the White House Council on Environmental Quality. 4 years ago, Samir ran for an open state in the Washington State House of Representatives, earning endorsements from every environmental group in his district. Samir's hobbies include writing rhymes. I hope he's going to speak to us in rhyme, of course. Reading the New York Times and Vox, and embarking on a quest to find Seattle's most caffeinated coffee. Our third speaker is Max Savishinsky. He's Washington PSR's executive director. Max brings 2 decades of leadership experience in the nonprofit, philanthropic, educational, social services, and development sectors, including directorial roles with Refugees Northwest, the Seattle International Foundation, the University of Washington, and the Council on International Educational Exchange. He holds Master of Public Administration, Master of Arts in International Studies, and Doctor of Higher Education degrees from the University of Washington. Max speaks Spanish and Portuguese and has lived, worked, studied, and traveled in over 40 continents on 6 continents. A native of New York, Max has called the Pacific Northwest home for over 20 years. So it's going to be a great program, and we're going to hear from our speakers in just a moment. Just a few quick housekeeping items first. First, to maximize our audio quality, you'll be kept on mute during the webinar. And apropos, I'd like to salute Julia Morgan, who's PSR's web manager, for handling all of the back end of this webinar. After the presenters finish, we'll have a question and answer. If you have questions throughout the presentation, please write them into the question box, which is in the dock on the right portion of your screen. I'll read those questions and our presenters will respond. Finally, this webinar is being recorded, and the recording will be made available to you and to everyone who registered within a few days. So with that, it's my pleasure to pass the mic first to Ken Lands. Ken, thank you so much for being with us today. We look forward to hearing how PSR has made racial and economic justice central to its work.
Thank you, Barb, and welcome everybody to this webinar. I wanted to start by introducing you a little bit to our Washington chapter, which has been around for 41 years now. Our current work focuses on 3 main issue areas: the climate crisis, nuclear weapons proliferation, and our newest effort around economic inequity and its impacts on health. For the past 7 years, our climate work has been done through a very active climate and health task force, which now has around 18 members. And for the past 5 years, we've also had a full-time paid climate organizer. We now have 4 full-time staff members, which includes our executive director, Max Savishinsky, who you'll hear from in a little bit, and an organizer for each of our 3 programs. We do a large part of our climate work as part of various coalitions, but I don't think any have been more impactful on the growth of our WPSR climate efforts than being part of the Climate Alliance for Jobs and Clean Energy. The Alliance is a historic statewide coalition made up of the state's leading environmental groups, labor organizations, communities of color, low-income groups, and faith, health, immigrant rights, and business organizations. And now tribal nations have joined the campaign as well. I say historic because this was the broadest, most diverse coalition to come together in our country to develop climate policy. Through our involvement in the Alliance for the past 6 years, we've made many strong connections with the frontline communities and EJ-based organizations that are part of the coalition. And our efforts assisting and working directly with them and through the Alliance have greatly elevated WPSR's visibility in the climate space, as well as our effectiveness and our influence in the broader community. With increasing frequency, we're being asked by other organizations to provide quotes, join on petitions and statements, testify on bills and policies, and speak at events, often specifically while wearing our white coats. So not only has our EJ focus been the right thing to do, it's also for us as an organization been the smart thing for us to do. We have so many more opportunities to use our healthcare voices, our trusted healthcare voices, and share our direct experiences as frontline witnesses to the human toll of climate change than we ever would if we hadn't gone hard into bringing environmental justice into our messaging and our advocacy. We, in turn, from our positions of privilege, can support frontline communities by echoing their stories and their demands and their calls to action. We do this in part by making clear when we write or speak that while climate change can harm anyone, it and associated air pollution strongly contributes to health disparities in the United States by having a disproportionate impact on low-income individuals, communities of color, and those with higher vulnerability to chronic health conditions, the latter of which, as has been highlighted by COVID, are quite often those very same communities. Now, I want to make clear that we don't come into these relationships taking charge or trying to call the shots. As I might say, doctors especially are often prone to do. If you keep it to its most basic, our job can be seen as very simple and straightforward. We're helping by providing others, stemming from our training, experiences, and base of medical and scientific knowledge, with sufficient understanding to take action to prevent disease and promote health. We're providing for them being individuals, colleagues, or elected officials, with needed information about how climate change affects their health, safety, and well-being, so that they can then take action to protect themselves, their families, and their communities. Now, I'll be honest, the work we've done in the Alliance has not always been easy. While the organizations that make up the Alliance may have come together with a common goal of dealing with climate change, we also came from very different points of view and from many different starting points, and with a whole bunch of varied and often conflicting priorities. But we've successfully pushed along and worked together through a commitment to a set of guidelines and principles built on three main legs: science-based carbon reductions, environmental justice, and a just transition. Perhaps most importantly, through everything we've done, and from the start, everyone, with the crucial inclusion of those most impacted by climate and climate change, had an equal voice and an equal seat at the table. For its first 4 years, the efforts of the Alliance were aimed at developing a statewide emission reduction ballot initiative that grew from our principles. It set a price on carbon and that had teeth. Samir, who will be speaking to you in a moment, will go a little deeper specifically into the environmental justice inclusions that were part of the initiative that we put on the ballot in 2018, and why the EJ community was so supportive of Initiative 1631. Barb Gottlieb herself, in an op-ed in The Hill, described 1631 as a visionary initiative. She went on to point out that it would establish the nation's first direct fee on carbon polluters, and that the funds generated by the fee would be invested in projects for human health and a cool climate, such as construction of new clean energy infrastructure, creation of new jobs, and support for displaced fossil fuel workers, for the protection of air, water, and forests, and benefits directly for disadvantaged and vulnerable communities. The health message was a key part of the Yes campaign, and WPSR went all in on Initiative 1631. 4 of the top 15 petition signature gatherers were WPSR physicians, all 4 who were actively in practice, I might add. And once on the ballot, many of us went door to door, handing out campaign materials, wrote op-eds and letters to the editor, spoke at events and rallies, and were quoted and appeared in our white coats on printed campaign materials, and were even featured in TV commercials for the initiative. We also led efforts to get the medical establishment involved, speaking out in a health-based support. A number of key medical leaders, hospitals, and medical organizations, including the state's largest, the Washington State Medical Association, took the unusual for them step of actively endorsing the initiative. But unfortunately, Big Oil, worried that passage could provide a model for other states, poured obscene amounts of money into a no campaign, ultimately spending more than twice the previous spending record in Washington, using the $32 million to saturate the state with their distortions and scare messages, and the initiative was defeated. Now, while the initiative may have failed, I can confidently say that climate justice and social justice and issues of equity and fairness in general are now part of the DNA of all of our state's environmental groups and their leaders, and of our own WPSR organization, as are the concerns of tribal nations and organized labor, and vice versa. Those relationships, individual and organizational, and those lines of communication may turn out to be the strongest, most important, and longest enduring legacy of this effort. Realizing the importance of those relationships, and the Climate Alliance Steering Committee again met a couple months after the election, we decided that our work was far from done, that we wanted to continue working together. Don't try to read all those names. I just wanted to show how many organizations we now have involved. The various well thought out pieces of policy that we had spent 4 years developing and incorporating together into the initiative were still worth working on, even if individually rather than as one holistic package. And these, what I refer to as the sons and daughters of 1631, though I have to admit that no one else seems to have picked up on my use of this phrase quite yet, these have provided the basis for much of the policy work we've built up, pushed in the state legislature over the past 2 years. Now, I'd be remiss if I didn't touch on how the COVID-19 pandemic is impacting the activities and thinking of the Alliance. I shouldn't need to tell you that the pandemic has made the healthcare inequalities that already existed in our nation all the more stark, and that the disproportionate impact of the pandemic on communities of color, the same communities disproportionately impacted by pollution and worsening climate change, cries out for remedy and redress, as does the pandemic of racism. So our Alliance's platform of policies has come together around what we are now referring to as a just recovery. It's time for me to pass the mic on to Samir, who toward the end of his presentation will zoom in on an important part of that just recovery platform, the state's Environmental Justice Task Force, as a sort of case study of environmental justice in action in Washington state. Samir?
Thanks, Ken. Can we go to the, yeah. Hi, everyone. I'm really grateful to be here, and we are very grateful for the extraordinary partnership that we have with WPSR and the work that all of you do as physicians and trying to protect human health very much links to our interest in creating environmental policy that improves human health. So largely what I want to share is a model environmental justice policy. I don't know what states all of you are from, but what we're doing in Washington state is pretty cutting edge, and it's something that could be replicated. And I worked with Ken on this effort, and I'll explain that. But I didn't have COVID in my presentation, but it just reminded me I should mention that, and the interconnectedness of that is just so crucial. People of color generally have poor access to healthcare. We're more essential workers on the front lines where we have a greater risk of exposure to COVID, and we are more exposed to air pollution, which makes us more vulnerable to harm from COVID if we contract it. And so that's the cumulative impacts of multiple factors, and you'll be hearing that term a lot, that's an example of cumulative impacts. So let me start by explaining who Front and Centered is. We're a nonprofit membership-based coalition representing Black, Indigenous, and people of color serving organizations in Washington. We have over 60 members who vary in size, scale of impact, and level of participation. Most of these organizations work in social and immigration services, educational programs, and very few of them actually explicitly advocate for environmental or climate policies as the whole part of their work. Some of those which you might be familiar with are like NAACP and LULAC chapters. But on behalf of this coalition and with their input, we work to advance a climate justice agenda. We came together in 2014 to ensure that communities of color had a seat at the table where decisions were being made to shape climate policy. And that table was the coalition that Ken mentioned, the Climate Alliance for Jobs and Clean Energy. Because of structural racism in the United States, the quality of the environment, the air, the water, the soil, is typically in the worst condition for people of color. We're typically the worst impacted by climate events because we have the least amount of resources to prepare and adapt to these changes, and we have fewer champions in government looking out for us. And so we want to take a holistic lens to addressing environmental problems, and that's just not looking at the environmental threats, but also the socio-demographic factors. And I'll get more into that. But we want to create public policy that remolds our institutions in the form of justice and ensure that we effectively respond to the climate crisis by making everyone better off. Next slide. So this slide shows Initiative 1631. This was one of the best designed carbon pricing initiatives that I have ever seen, because it was designed to be effective in reducing emissions, and it was holistic and looked out, holistic and just. It looked out for everybody. I'll just mention a couple of the things in there that made it equitable. One was the Healthy Communities Fund that you see. There was money in there for on the west coast of Washington. Some of our tribes are losing their land due to sea level rise, and so there would have been money to pay for the relocation, which is obviously critical. There was energy relief for low-income households and that would have effectively erased any potential energy cost increases that might have occurred as a result of the carbon fee. And then the main thing I want to focus on is the investments to benefit health action areas. So 35% of all revenues of all expenditures would have had to have gone at a minimum to those communities, and those communities would have been identified by a cumulative impacts analysis. And that is where you assess the compound threat of multiple risk factors. Exposure to air pollution, proximity to hazardous waste sites are some of the significant environmental threats, but it's also combining that with the unemployment rate, the income, the education levels, the access to transit, the different, I think, lead exposure. And there's a multitude of factors, and you kind of combine that to get a holistic sense of the health of the community. And so those that rank the worst, and I'll explain more of what that rank is, would get 35% of the revenue. And so although this initiative did not pass, we wanted to keep that concept alive of getting the government to prioritize its environmental dollars according to this lens of going to the communities that need it the most. Next slide, please. So what we did was, so the ballot measure failed in 2018 in the fall, but the legislative session was starting up in January 2019, and so we took that cumulative impacts analysis requirement and we put it into a bill, and then we broadened it to essentially what we proposed with the HEAL Act was a mandate that state agencies, or probably the state government as a whole, implement existing environmental laws, existing laws that are on the books, implement and enforce those laws with the goal of creating a standard of health quality across every community, the same standard. So, and that standard of health quality would again be calculated by a cumulative impacts analysis. And so agencies would have had to prioritize their funding, the grant programs, the outreach that they conduct, and the prioritization of enforcement according to environmental justice principles. And they would have had to have conducted their work with the objective of reducing health disparities. And so this would not have created a new law. Wouldn't have created a new law, no new regulations. It just would have made the existing regulations on the books implemented more effectively and efficiently, and with a lens of justice. And it would have really put the human health aspect at the very top. That would have been the goal of the environmental laws. Next slide, please. So this is a look at the environmental health disparities map. If I could, I would actually love to do a live demonstration of it right now. I will share a link in the chat so you can go check it out. This map lives in the Washington State Department of Health's website. It ranks the health quality of every census tract in the state, with those areas that are redder being more at risk. And the risk level is calculated according to the cumulative impacts analysis, where the combination of multiple risk factors. But the beautiful thing is that you can also isolate individual variables and see how communities rank according to education levels, for example. And our goal with the HEAL Act, the Healthy Environment for All Act that I just showed, was to get the government to use this map to guide its programmatic work, its outreach, and its enforcement work. And I could be wrong, but I think California's EJ screen may be the only other state map that has this. I mean, there might be something in New Jersey or Illinois that I've heard, and obviously EPA has the EJ screen. I don't know if even EPA's EJ screen is quite as robust as this. So this map is truly cutting edge. Next slide, please. So this is just a visualization of the formula so each census tract is ranked according to their level of health quality, and that level of health quality is determined by this formula. It's basically you multiply the environmental threat, which is your exposure to certain pollutants like diesel is one of them. I think there's a couple other pollutants. It's wastewater discharge. It's proximity to Superfund sites and other hazardous waste facilities. So those things make up the environmental threat. And obviously proximity to an environmental hazard matters for many reasons, one of which is if there's a climate change event and that waste facility is not protected adequately, there aren't safeguards there, then maybe there's a leak there, and so that will definitely affect the community nearby. And then you want to calculate the socioeconomic factors, and let's say there's a leak that happens and the surrounding community doesn't speak English as a main language, and so maybe they have challenges to being made aware of the leak, and so you want to account for that, for the linguistic vulnerabilities, and of course you want to account for income and education level. And pre-existing conditions, and so all of these factors combined, really gives you a more accurate picture of what the quality of the community is, and it also gives you a sense of the multiple things that you need to actually address in order to improve the community health. Next slide, please. So our effort to pass the HEAL Act in its entirety was stalled by opposing powers, and I think that's notable. Largely, the state chapter of the State Chamber of Commerce and the Farm Bureau opposed it, and that's quite notable. I think for one reason is that they may have been concerned that that as a result of this law, enforcement would have happened more vigorously. So that's just worth pointing out. But although we didn't pass it, we made significant progress. The result of working, we worked hard with our members on advocacy as well as partners in the Climate Alliance for Jobs and Clean Energy. I worked with Ken numerous times on numerous occasions to testify on the bill. I worked with Sarah, who used to work at WPSR, on various advocacy actions because this was an all hands on deck effort to get this bill across the finish line. And although the mandate didn't pass, the mandate requiring state agencies to incorporate EJ in their work, we didn't pass that. There was an oversight body that would have been a part of this task, or a part of the bill. And that oversight body did get created, and it was turned into a task force. And the task force had the charge of coming up with a report to the governor and legislature on ways that state agencies can incorporate EJ principles into their work, and that those recommendations are due in a report at the end of October. And my organization, Front and Centered, is co-chairing this task force. So we have a very central role in its work. Next slide, please. So what we've been trying to accomplish with the task force is, I should note the task force itself as an official body is going around the state to do public meetings, to collect input, to inform its EJ recommendations. And since COVID, those meetings have gone virtual. On the side, I am going across the state and engaging our members and engaging communities by hosting listening sessions, which have also now gone virtual, to talk about environmental justice, to prepare communities, to inform the work of the task force. And the findings that we get will go to inform the task force work, and we're going to produce our own report. And we'll collaborate. I'll collaborate with PSR on some of these findings where we identify particular issues where we can advance policies, and to some extent, this partnership's already happening. One of our members who is of the LULAC chapter in Southwest Washington, who I've worked with and has become on an event and has become fairly fired up on EJ issues, is serving on a panel that PSR is going to be hosting in October. So we are those recommendations come out in October, and then that is essentially a policy blueprint that we're going to collectively have to work for to get passed in the legislature in 2021. And there's multiple ways that will work. There's going to be lots of other policies that are moving ahead, but this environmental justice layer will be critical to get enacted in some fashion. It may be called HEAL Act 2.0. Next slide, please. So this image here is an image of a lobbying day that we had for the initial HEAL Act in 2019. You see some of our community partners. You see Ken. This was at a lobbying day, and we had just got done testifying. And again, because our work is focused on addressing health disparities, and your work as physicians is focused on improving human health, there's a very natural connection. And Ken was able to describe in detail in his testimony the health benefits of targeting of focusing government on communities that are disproportionately impacted, and focusing that work to improve their quality of life. And I should note that our partnership, was largely due to our friendship and an interpersonal relationship. So definitely being on the ground and being in the spaces where you can develop those relationships is critical. And obviously that's all become more difficult now, but hopefully in the coming months we'll be able to interact with people, each other again. And we very much look forward to a collaborative partnership in 2021. It's not going to be easy to pass the Healthy Environment for All Act, and as you can imagine, our community has a lot of stuff on its plate. So we will look to PSR to really co-lead this effort to get it across the finish line. And thank you. And that's all I had.
Thank you, Samir. And now we'll hear from Max Savishinsky, the Executive Director of PSR, Washington State.
Wonderful. Thank you so much, Barb. Thank you, Ken. Thank you so much for joining us, Samir, and thanks to all the attendees for being a part of this presentation today. Again, my name is Max Savishinsky. I'm the Executive Director with the Washington State Chapter of Physicians for Social Responsibility, WPSR. And I have just a few minutes to tell you about one of our programs that is very relevant to the topic today, and that is our program on economic inequity. This program, which is the third and most recent of our three programs, fits under the umbrella that PSR and WPSR works on, which is trying to address the greatest and gravest threats to human health. And some years ago, our board of directors determined that along with the threats of climate change, and nuclear weapons, that growing economic inequality and the wealth gap in our country, as it's true around the world, also presents a society-wide and existential threat to human health and is a major driver of health disparities in our communities. And so we added this as a third pillar program of our organization, which has slowly but surely grown to reach the point recently where we finally brought on a full-time staff member to lead this program, as we have for our other programs. And this program is, in addition to just addressing the important issue of economic inequity, it is a program that has other relevance to the work that we do because of how much it is rooted in the concept of justice and the fight for justice, which is a common thread among our programs, which we are increasingly trying to weave together and to make sure that our supporters and people interested in these issues understand that justice is a critical component of everything that we work on, and that it is what connects these issues together in many ways. So in terms of our work on economic inequity, we just after time thinking about how it is that we can be in the best position as a healthcare professional organization to address this issue in the way that we do our other issues, by using the health voice to talk about the health impacts of these problems. We put together a task force of people drawn primarily from the healthcare professions, but it's made up of men and women, white folks and people of color, and folks from the more urban Seattle area, as well as the more rural east side of the state. And this group is working to drive our work, our strategy and our execution of our work to advocate for policy change when it comes to economic inequity, under the presumption that it is a major driver of health disparities. And so the three categories of sort of sub-issues of economic inequity that we sort of focus on, or the way that we categorize this work, is to focus on, first, tax reform and progressive taxation. That is an issue everywhere, but in some ways more in Washington than almost any other state, because Washington has the unenviable position of having the most regressive tax code of all 50 states in the country. So that means that poorer folks are paying a much higher percentage of their income to support their basic needs, and that is at a time when Washington has, I believe, more billionaires than any other state in the country. I think we have 12 in our state, many of them you know very well by name, and is also the home to companies that are some of the largest and wealthiest, not only in the state or country, but in the world, and who are reaping enormous benefits during a time, during this pandemic, when many people are suffering immensely. So working to reform the tax code in Washington is a major pillar and major effort of ours. It's something that feels sort of removed from health policy, but when you look at the need to make our tax system more fair and to use it as a vehicle for providing funds to the state to support basic needs, it becomes clear how important having a fair and equitable tax code is to supporting all people and supporting public health. So we work on Washington does not have an income tax, for example. That is a very heavy lift, but is something that has been sort of on the progressive agenda of many organizations for some time here in Washington. In this state, it actually requires an amendment to the state constitution in order to institute that. But I think it is one of the major aspects of our regressive tax code that needs to be reformed. There's also efforts to look at our estate tax, to institute a wealth tax here as wealth grows and the income gap grows, and to put into place a state's version of the working family tax credit, which actually was passed into law here but has not yet been funded. So it's actually on the books but has not been funded to provide essentially cash assistance to needy families. The second area that we work on is social spending writ large. So in some ways that's a complement to the taxation, which is about bringing in revenue to the state, and then looking at, in terms of social spending, how that money can be spent in ways that best support equity for communities and populations that are suffering during times like this. And then the third pillar of our work is focused on what we sort of call fairness, opportunity, and access. And so those are policies, those relate to policies that may not have anything to do with taxing and spending or money in and money out, but really policies that help to provide access for folks to opportunity. So examples of that would include things like affirmative action, housing policy that opens up access to lower income folks to get to affordable housing, and housing, as in many places, is a massive issue in Seattle and across the state. So over the years that this program has been coming to fruition, we have worked on policies like paid family leave. Washington instituted one of the most robust paid family leave policies, which just came into effect on January 1st this year. That was a major victory that our organization got out to do a lot of advocacy work with decision makers and policy makers and educating the public. Last fall, we got behind a couple initiatives at the state to extend and provide Medicaid benefits, notably to extend and expand Medicaid benefits to new mothers postpartum. We have also worked on racial equity issues, including issuing statements around police reform and police defunding, on housing. We've been very active in this COVID recovery space and advocating for a just recovery to the COVID epidemic and the pandemic here, which included floating a petition, a statewide petition for healthcare professionals in Washington state, advocating for a variety of principles supporting a just recovery to COVID. We had got hundreds and hundreds of signatures for that petition, which we just recently distributed to every state level elected representative in Washington state. And we have been very actively speaking and publishing op-eds and letters to the editor and hosting webinars, particularly about the push against austerity. So at the time that the state is facing massive budget deficits, like have never been seen before in history, we are trying to educate the public as well as decision makers about the mistakes made during the last recession, in which massive budget cuts were made in response to deficits that just created new problems instead of fixing the ones that were being created by the recession. And so we know that people's health suffered tremendously from that, because most of those cuts come out of social programs that support people's basic needs. And so we are now sort of deep in the advocacy space to try to prevent the state from taking an austerity approach in response to the budget shortfall. So that's sort of an overview of our economic inequity program. We're extremely proud of it, very excited about this work, excited about how it interconnects with our other programs, and we're already seeing a lot of collaboration between our staff, our task forces on these issues, and think that it has a tremendous amount of promise to address an issue that is more important today than it ever has been. So I will leave it there, and thank you again for having me and for being a part of this conversation today. Barb, back to you.
Well, thank you, Max, and thank you, Samir, and thank you, Ken. This has been such a very substantive presentation, really fascinating, and I think it's really illustrated for us that green justice is both an urgent need in this country and much greater than just a question of climate change. We do have a number of questions. I'll start with this one. I think this is probably for Ken. It says, we find it hard to recruit health professionals to be activists. How did you do it? How many health professionals did you engage in this coalition campaign? Ken?
Yeah, it's harder. I don't want to come off as an old timer, but when we first got PSR going in the 80s, it seemed to be an awful lot easier to get even young physicians, people with just starting families or just starting their medical practices, to get involved. And whether that was some holdover from protests for the Vietnam War or whether it's now because people are busy on the internet or whatever it is, it's a truth that it's harder it seems to get health professionals involved in advocacy in many ways. The program Max was talking about, our economic inequity program, seems to be the space, I'll just say, where we're having the most young physicians and physicians getting involved and excited about becoming advocates. So, maybe it's a gateway to get them involved in other things. As far as our advocacy over the initiative and climate, we haven't had trouble. Like I said, we've got 18 people on our task force, which meets every month, and most of whom are available and have done testifying or public speaking or writing letters. I'd say about half those people came from a series of trainings that we did. We did a number of all-day trainings on how to speak out about climate change, about the health impacts of climate change, and how to be a health advocate. And from talking about the science of climate change, how to write letters to the editor, how to do communications, tough questions you get, how to tell a story, and so forth. So about half the people in the task force came from those trainings, which are a good way to educate people and to get people involved.
Great, thank you. We have a question here which is directed to Samir. It says, can you discuss your decision to use the strategy of passing the HEAL Act rather than filing lawsuits naming the federal and/or Washington EPA to compel them to enforce existing environmental laws?
Yeah, that's a really good question. I think one thing to note is that you need to have laws on the books that require that surgically require cutting pollution where it is the most harmful. So there's a lot that can be done with existing laws, but I do not believe there is a law on the books that actually requires agencies to do their work surgically and to improve human health. Certainly there is President Clinton's executive order that is technically still on the books, and that was an environmental justice order he issued in 1994. But even that is really enforced by choice by federal agencies. And one thing you may be interested to know is that one of the recommendations we're coming up with on the task force is to take those obligations of Clinton's executive order and put them into law in Washington state. So I think we may not have been as successful if we had gone the litigation route versus the legislative route. Given that.
Okay, thank you. Actually, before we move on to the next question, let me just encourage people to take a look at the chat section. Samir has posted the link to the map that he was showing us, and you probably want to see it in the interactive form. So you can find that in the chat section. Also, if you want to ask a question, don't forget to type it into the question section. We have a question here that says, face-to-face relations are important in environmental justice. What did PSR do to have more connection with environmental justice groups? I guess that's probably for Ken, maybe for Max.
It's harder now, and what we're basing our work on is existing relationships. We've brought on a new climate organizer, Nick Manning, about 2.5 months ago, and so getting Nick to meet some of the leaders of a lot of the organizations has proved more difficult than it would have been the pre-COVID days. So it's a matter of being a little bit more proactive. In the past, it was just I guess we were fortunate when the Alliance for Jobs and Clean Energy was first forming to be one of the initial organizations that got involved. And so a lot of those relationships grew organically out of that fact. I guess we were ready for it. When we were approached or when we heard about it, I think we asked to be put on that steering committee so that we could develop those relationships. And through those monthly meetings and through various task forces and so forth, policy groups that were put together to develop the initiative and the policies, those relationships just developed. Part of it was just putting ourselves out there, letting people know that we were available, and saying that we were willing to speak out, to talk about the health impacts of climate change. You know, like I said, it's a very simple and straightforward, and it's a service that we can provide. It's just when somebody's got a policy they're trying to do, we can go in and say, these are what the health impacts are. And I guess I could say we were part of other coalitions before to stop coal terminals, export terminals. The biggest export coal terminal would have been Washington State, and the biggest export oil terminal. And so a number of the environmental justice groups were part of those coalitions as well. And so just got to know people. And as Samir said, a lot of the important relationships are not just organization to organization, but are person to person. You put yourself out there, you get to know people, you talk to them, and it's a little harder. You need to put a little bit more direct effort these days when it's not face to face, but it's still possible.
Got it. Thank you.
Samir, I'm just wondering, from Samir's viewpoint, how can PSR leaders approach environmental justice organizations to get more of a relationship going? What's the best way to do that?
Yeah, that's a good question. You know, I just one example. There's CMAR health clinics that serve disadvantaged communities. You know, there's probably, I'm sure there are such health clinics in your states. So maybe figure out how to approach them for engagement and involvement in your work. And also just, you know, acknowledge your intent and your awareness of wanting to put environment, center all policies, put justice in all of the policies that you're advocating for. Certainly convey that, but also just go show up at events. Go to like the NAACP chapter, become a member. Anybody can become a member of the NAACP. Go show up at events and just, you know, listen and just make contacts that way. I would say go to community public events and as a way to start getting yourself known and forming that relationship. And trust takes time, you know. So you got to be patient and you know, have long-term plans and patient and persistent and keep showing up and you know, letting, you know, people will know who you are and that you're genuinely interested in this stuff if you keep at it. I would say, just off the top of my head.
That makes a lot of sense. Be there, show up, listen, be patient, and commit yourself for the long term. That sounds like a good strategy. We have just one more question, and unless somebody else wants to quickly put a question into the chat box, it says, how did community and tribal organizations work in this coalition? Did they take leadership? So perhaps Samir, that would be for you. Perhaps Ken, who'd like to take a crack at that?
Why don't you go first, Samir?
Well, if they're talking about the Climate Alliance for Jobs in Clean Energy, tribal input came. It didn't. I think it wasn't there at the very beginning. I think the policy got adjusted once we heard from the, I forget the name now, the affiliated tribes of Northwest Washington, or of the Northwest. So tribal input was included in the creation of 1631, and I will say that it made the policy better. Prior to that input, 1631 did not cover carbon sequestration for soil or aquatic plants. It didn't offer incentives for those. But once we got tribal input, it did include that. So it made it better. And as far as the front and centered, it's also something, frankly, that we need to work on. There's often, like it really depends. I can't say that tribes are there. It's not a monolith. But one of our board members is with the Na'ili Fund, who does represent tribal members who are just living in urban environments. So we're definitely connected, but we could even do more to work with tribes. But there's also the government-to-government relationship thing that you want to be aware of. So, yeah, that's my response.
Well,
if I could just be in total, in just total transparency, the tribal piece was one of the things in the alliance that we didn't do as well at first, in spite of trying to bring everybody to the table. And it's complicated because it's, as Samir mentioned, it's really government to government. They're sovereign nations, and so the relationships have to, go through the leaders, and so it makes it a little bit harder. But once we became aware that we weren't handling that as well, I think getting those parts into the initiative made it a lot stronger and improved that relationship. Although there still is work to be done. The tribes, I forget if we've got 21 or 31 in our state, so a big presence in Washington State, bigger than in a lot of places. But it's still something that we need to work on.
Well, I think your frankness in addressing that, both of you, is really important. These relationships, whether or not they're complicated by the government-to-government level, these relationships can be delicate, and we can be perhaps uncomfortable stepping into them. But that's exactly what the times call on us to do, and this is the way we're going to move forward. And I think all three of our speakers made very clear that the work of PSR, our work for a cleaner, healthier, safer world and a more just world, isn't independent from work for racial and economic justice, not at all. And in fact, it's strengthened our long-term goals, blend with those goals, and we strengthen one another in pursuing them. So I thank all of our speakers for being with us this afternoon. I thank our audience, and thank you very much for being on our webinar. Goodbye.
Bye, everyone.
Thank you.